This Health Minute is brought to you by St. Francis Health. We listen, we heal.
Welcome back. Well, doctors say a new FDA-approved blood test for colon cancer may be an answer to a growing problem. As Ashland Brothers reports, convenience, they say, could lead to more screenings.
It's the second leading deadliest cancer in the U.S., but doctors say very preventable with proper screening.
No, it's a serious thing.
Jess Palazello lost her brother to colon cancer. At first, the pain and symptoms were thought to be a work-related injury. By the time he was diagnosed, it was too late.
I miss him dearly.
Dr. Jonathan Mizrahi says many eligible adults avoid the screening process altogether. And that's where the FDA approval for using the Shield test can really make a difference.
This is a very good day. It is another non-invasive tool to close that gap between the folks that we want screened and the folks that actually are getting screened.
This just years after the U.S. Preventative Services Task Force lowered the suggested screening age.
We are seeing a troubling and increasing trend of younger and younger patients being diagnosed with colorectal cancer.
The liquid biopsy, which detects tumor DNA in blood samples, is for adults 45 and older at an average risk for colon cancer. Recent studies suggest it's more than 80% effective at detecting stages 1, 2, and 3 colorectal cancer.
You could get drawn with your other routine blood work that you might do when you go to the doctor.
A clinical trial found that the Shield test false positive rate is about 10%, and it only detected 13% of large polyps or precancerous lesions, which can be removed before developing into a tumor. Dr. Brobson Lutz says the technology is very good, but so is the marketing.
I suspect that the PR on these is better than the medical advance, if you want to know the truth.
He's happy with the existing stool screening tests and says it's not a replacement for colonoscopies.
The colonoscopy will remain the gold standard for colon screening. I'm all for newer technology when it's cost-effective and accurate and gives good results.
Dr. Mizrahi says it comes down to each individual patient.
I think we all in the field of medicine need to be very comfortable moving with the field. I absolutely think this blood-based way of testing can be the way of the future as we refine kind of what exactly we need to be looking for.
Palazello is just thrilled there's progress being made.
I think that's great. Early detection is, I think, the key to, especially with colon cancer. Yeah, let's go for it. Let's do early detection.